first of all, I'd like to just acknowledge or thank you guys for having me today to be able to speak with you. And just acknowledge too that this is a little different in terms of doing this virtually. Typically, you know, we're in a little nice cozy room, I would assume, and we can all see each other and see each other's expressions, and it's a different experience. So with that, you know, usually when I'm talking with folks, I like it to be fairly interactive, more of conversational kind of style, less of me kind of lecturing. And so we can see kind of with our current technology, how we can kind of mimic that. So please, yeah, I have some of you guys kind of on the screen. So, you know, feel free as I'm talking, we can try and see how it rolls in terms of just unmuting yourself if you have a question as I go. I don't mind that. It's a little bit nicer kind of in that way too. So today, what I'm going to talk about, I'm going to talk a little bit about the psychological challenges and how to cope with, you know, lung cancer diagnoses and treatment, and then survivorship too. And I'll talk a little bit, so Lynn, go ahead to the next slide. I'll talk a little bit about common psychological themes, thinking about rates of anxiety and depression, and then want to pivot a little bit. I think I would be remiss not to talk about the current pandemic and the impact then that it has on folks with lung cancer and as folks are going through treatment too. It's a really different world. There are no good times to be diagnosed with lung cancer or to be going through treatment for lung cancer. But I'd certainly have to say that right now during the COVID-19 pandemic is certainly not it. It really makes things a lot more difficult for folks. So we're seeing a huge exacerbation of mental health concerns within our cancer population right now. And I'll talk a little bit about that kind of specifically in terms of kind of lung cancer too. And then at the end, talk a little bit about coping strategies and, okay, so these things are pretty common for folks. What can you do about them? Okay. So next slide. Okay. So I want to talk a little bit about just the team that I work in here at Levine Cancer Institute too. Is that this is the building. So what you see kind of behind me is my office, and I'm on the 7th floor here of this building that you see here, the very top floor, the penthouse they call it. And although my office doesn't have any windows, we do have some windows that the offices do have windows, and some exam rooms and everything else that have offices in our conference room that we're not using right now because of COVID. Everything's kind of on the computer these days, all of our meetings, but it has a great view of uptown from the top kind of windows there. But that's our building. And I'm housed within the Department of Supportive Oncology. And there are 8 different sections to my department. So we have palliative medicine, we have psycho-oncology, and that's my section where we have a group of psychologists, psychiatrists, social workers, and psychotherapists within my little pod, my section. We also have cancer rehab, so that's a physician, OT, PT. We have integrative medicine with a physician, and then they have a PA that also works with the team. They offer acupuncture, massage, healing touch, yoga, tai chi, art and music therapy. We have registered dietitians that are part of our team, nurse navigation, senior oncology, and then a whole section with a physician that leads our survivorship group too. So it's a large kind of multidisciplinary group that we're housed. And our whole focus is to be able to try and impact, not only kind of help with the symptoms that folks experience that go along with cancer diagnosis and then cancer treatment, but we're also really broadly trying to impact quality of life. And that's the whole goal, is for us to be able to really improve folks' quality of life as they're going through cancer and cancer treatment. So next slide. Okay. So what we do know, though, is that lung cancer can affect both folks' physical being and also their mental health. And we see a huge kind of impact on folks' quality of life, not only from kind of the actual diagnosis and the cancer itself, but then the treatments that people receive to be able to address the actual tumor. And so, we know that all of this, like I said, can really impact folks' quality of life. So next slide. Once we have kind of a diagnosis, and I came kind of in the tail end of the conversation that we were just having, so it seems like, we have some folks in here today that are, you guys are just dealing with a new diagnosis right now, so maybe some of this also kind of resonates. But when you receive a diagnosis, there's considerable stress that people experience. It's shock, it's denial, can be loss of dreams and grief that people experience, fear, hopelessness, thoughts about death, about dying, a heightened awareness of life's brevity, about your own mortality, a search for meaning a lot of times too with a diagnosis. And through this process, you need to adjust to not only kind of the symptoms of the cancer itself, but kind of the physical impact of treatment, feelings of vulnerability, loss of control. There can be a huge impact on how you see yourself and your self-esteem. Of course, there's financial concerns that come up in terms of the cost of your medical care. And oftentimes the disease makes it so that people aren't able to work anymore too. And so then you have kind of a double whammy that comes up, not only in terms of loss of employment, right? And so you don't have that kind of income coming into the household, but then you're getting hit with a huge kind of set of medical bills too. So then it's this double whammy that people experience. And then people often grapple with changes in functioning throughout the disease process, and it can really threaten folks' independence. And this can be very, very scary in terms of having to deal with this idea of loss of independence and then dependence on other people to do things that you previously did for yourself and didn't need other people in those ways. So for all of these reasons, go ahead and flip to the next slide. You can understand why, in the slide after this one, I'm going to talk about why kind of the rates of worry, changes in mood are quite high, okay? But what we do know is that cancer is not just a disease that impacts the person with the actual tumor. It impacts the whole family system. So the whole family system, and close friends too, often experience increased stress and worry and fear themselves, loss of control. There can be a change in a dynamic in people's relationships, right? So just giving an example in terms of a spousal kind of or a partnership, there can be kind of a change from maybe kind of spouses to one of kind of a patient and a caregiver, right? And so that can be really difficult for both the patient, but then also for then the spouse of the patient to adjust to too. Can be changes in terms of kind of the family structure. So you can feel threatened in terms of your roles as a mother, as a father, as a wife, as a husband. All of these roles can change because of a diagnosis, because of the disease itself, and then needing to go through treatment too. And these particular issues can impact children of parents with diagnosed with lung cancer, but then kind of the spouse, the partner of that loved one too, and they can impact them in different ways. Next slide. So as you can see from these statistics, and these statistics are from cancer in general, so not just lung cancer in particular, okay? But what you can see is about 33 to 56% of cancer patients meet criteria, so diagnosable criteria for anxiety or depression. And when you think about distress, right, which is actually not kind of a diagnosable kind of issue, right, or condition, those numbers are significantly higher in terms of folks impacting, kind of experiencing severe distress with a cancer diagnosis or going through treatment. And so you can see that this is something that impacts probably more people than not. And so anxiety and depression, it's quite common, okay? And what we do know is that folks that are experiencing advanced disease, we know that the rates of anxiety and depression are actually higher within that group of folks that have more advanced disease too. The thing for us is when we're thinking about worry or when we're thinking about changes in mood, these types of symptoms can really mimic some of the symptoms that folks might experience because of the cancer itself, or because of the impact of treatment. So let me give you guys kind of an example. Fatigue, okay? So fatigue is one of those symptoms that can overlap with anxiety and depression, but also overlap with chemotherapy. And so part of what we try and kind of figure out is how to tease apart kind of what is maybe driving the expression of these symptoms, okay? So let me give you another example, shortness of breath, okay? This is one of those symptoms kind of within the lung cancer population that could be associated with the tumor, right? The cancer. Or it could be panic attacks in terms of anxiety. And so there's this overlap between kind of, like I said, symptoms of anxiety and depression or worry, changes in mood, cancer itself, and then also the treatments that people experience. Next slide. So just kind of running through, kind of taking a step back and thinking about, okay, so what is depression? And before I kind of talk about that too, you know, and I talk a little bit more about this in terms of kind of what maybe gets in the way of people actually talking about changes in mood with other folks. There's a significant amount of stigma that gets associated with mental health issues. And especially I think in the South too, it's not something that we talk about very often. We don't talk about it very openly at times. And there can be a tremendous amount of shame that comes up for folks with that, okay? So that's why the other reason why I put those statistics up there in terms of just actually how common this is for folks. But when I think about depression, I think about increased tearfulness, withdrawing from social activities, no longer enjoying activities, so not really being able to get that same sense of pleasure that you might from previous activities that you would enjoy, not being able to concentrate. Folks might notice that their behaviors in terms of substance use change, so they might be looking more to alcohol to be able to try and kind of numb some of those emotions, using other drugs to be able to block difficult emotions. They might experience guilt, feelings of being a burden, frustration, indecisiveness, fatigue, changes in sleep, changes in appetite, or significant weight loss or weight gain too. So you can kind of see also from going through some of that, so some of those symptoms actually might mimic kind of different treatments that folks are on too, or just their disease as well. Next slide. So what do I mean when we talk about anxiety then, okay? I think about anxiety in a couple different ways too. So anxiety, we can experience a lot in our body, okay? So it can be panic attacks, or not even kind of reaching kind of that, what we would call kind of a diagnosable panic attack, but kind of a couple symptoms like shortness of breath, chest tightness, shakiness, dizziness. All of those symptoms can be panic attacks, feeling of being overwhelmed, having difficulty, I guess, bringing your thoughts under control. So thinking that thoughts are racing in your head, having difficulty calming them down, having difficulty with focus, muscle tension, fatigue again, irritability, restlessness. Some folks might experience nightmares or flashbacks. And interestingly, just on an aside of that too, is that folks that have previous trauma coming into a cancer diagnosis, oftentimes we experience kind of a heightened, so for example, if they had military trauma prior to a cancer diagnosis, they come into the diagnosis or treatment, and we might see kind of a surge in nightmares or flashbacks or PTSD symptoms that folks might experience too. And that's not uncommon, and we see that with other types of trauma too. Next slide. So thinking about the pandemic too, is that this is the most recent information that came out of the CDC. So this was, I don't remember the report. I think it was a July, August report maybe, from the CDC. But it recently came out. They took a survey of, you can see over about 5,500 folks. And they called them in the week of June 24th through 30th, and it was reported out a lot later than that. But what they found from taking this national survey is that about 31% of folks were experiencing anxiety or depression, okay? 26% of folks were experiencing a specific trauma, kind of PTSD type symptoms. And about 13% of folks were saying that they had increased their use of substances to be able to try and cope with the pandemic. This is the shocking piece of what was also in that report, was thinking about suicidal ideation. 11% of those folks indicated that they had seriously considered suicide in the past 30 days. That's shocking, okay? And when they broke it down into different subgroups, they found some differing levels of kind of suicidal thoughts too. We saw maybe about a third of 18 to 24-year-olds were experiencing suicidal thoughts, about 20% of Hispanic respondents, about 15% of Black respondents, and about 30% of unpaid caregivers for adults were experiencing suicidal thoughts, okay? So this is huge. So from my perspective, we're not only dealing with an issue of the virus right now, we're dealing with a huge mental health issue, a huge mental health crisis in the middle of this pandemic, okay? And what I also want to point out about this data too is that this is for folks, I don't know how many folks within this sample have been diagnosed with cancer too. My guess is it's probably a smaller percentage of this population. They probably caught some people in that survey, but it's not a survey focused on folks with cancer, okay? And we know though that there's kind of a double whammy that folks are experiencing with a cancer diagnosis in the middle of the pandemic. And so what I've seen clinically in my own practice is that, and I only work with folks who have cancer. So that's or have had cancer. That's all of the folks that I work with. But anxiety and depression are skyrocketing right now. next slide, and I'll talk about a little bit of those reasons, kind of why. Okay. So, one of the things that we can kind of think about here is that, folks with lung disease are at higher risk for poor outcome with COVID. Okay. And also, there's also the possibility that folks might be immunocompromised during this time because of them receiving different treatments too. That makes it so that they're immunocompromised. And so that makes them kind of in a high risk population too, okay? So you can see that there's a lot more fear in terms of kind of the ramifications of contracting the disease for folks than would be maybe in a different kind of population without a lung cancer diagnosis or lung disease, okay? I also we see kind of changes to social support that have happened during this time. We see, and part of this is because of maybe stricter kind of social distancing or physical distancing practices. And I actually prefer to use the term physical distancing practices. You hear folks kind of in the media talk about social distancing. And there's an infectious disease physician that was talking about this on one of our kind of morning calls, LCI-wide, and she talked about it in terms of trying to differentiate between social distancing and physical distancing, and trying not to get kind of confused in the middle of that, because what we're trying to do from a public health perspective is to be able to physical distance, not necessarily social distance. And I know that those two overlap a little bit too. But we see kind of changes, folks experience changes to instrumental support, right? So where folks might have kind of a large network to be able to help you drive to appointments, for example. You might not have kind of access to those same folks, either because of their own social or physical distancing practices, right? Or because of not wanting to kind of decrease your own exposure. So you don't have that same level of support, right? You might have had, for folks that are dealing with kind of younger children or children, there's an increased kind of burden right now in terms of trying to care for folks, especially when schools are remote. So you're trying to do virtual learning during the same time that you're trying to also manage your own health care, you're trying to manage appointments, and you don't have the same level of support. There's changes to emotional support too, because you're not spending maybe the same time with people that would give you that same sense of kind of emotional closeness. So you're not touching kind of the people in that same way because of fear of contracting the disease of COVID. So there's this constant kind of assessment of risk process that you have to kind of go through when you think of doing anything kind of in your life that becomes exceptionally fatiguing and really challenging to try and negotiate all of those decisions. And, one of the things that, social support is incredibly important in the middle of kind of cancer treatment. And so to have distance or to have changes to social support becomes really, really hard during this process. Two, what I find is that relationships oftentimes are the things that give folks quality of life. They're the things that give people purpose, and they give folks kind of value. And so when you start to kind of strip away contact with those relationships, because of physical distancing, folks experience kind of more anxiety and more depression. And then two, when we talked about kind of the double whammy of going through cancer and the finances, during this time too, folks are also losing their jobs. They're not having, they might not be able to kind of work in the same capacity that they were. So kind of knowing, like, for example, frontline workers that have lung cancer too, aren't able to serve, even if they're able to work right now physically, might not be able to serve in the same capacity that they were before because of risk of contracting COVID. So they need to maybe transition to a new role or aren't able to work at all, even though maybe physically they're able to work, right? But it's because of the pandemic and risk of contracting COVID that then their employment or their roles change too. Go ahead, next slide. So when we think about, okay, so what do we do about this in terms of anxiety and depression? I talked to folks about 3 different paths that folks have. There's the behavioral, non-pharmacologic interventions that we have, and we have really a whole big pot of interventions that we can choose from that are non-pharmaceutical. So this can look like cognitive behavioral therapy, acceptance and commitment therapy, mindfulness practices for folks, okay? And then another path is thinking about a medication path. So this is a more pharmacologic pathway. And then the third option is thinking about a combination of both medication and thinking about non-pharmacologic interventions too. And really the combination of these two together is what we think of as being the most aggressive path of treatment, okay? One kind of other aside to kind of think about this too is that if folks were previously on medications before the pandemic, what we found is that these medications might need to be readdressed and reassessed, and medications might need to be changed during this time, or we might need to be adding on adjunctive medications, so things like for sleep, for example, to be able to help folks cope with the pandemic. Next slide. Okay. So when I think about just some of the basics, and when I think about some of the basics in terms of all of us as we're all going through the pandemic too, I think about a couple of different things. I think about prioritizing activity levels. We're all getting fewer numbers of steps these days because everything, I'll just speak for myself in terms of my own life. My life right now is kind of sitting in front of this computer screen. And so even the small amount of steps that I used to have kind of during my day in between appointments, I don't get those anymore, right? And so just thinking about, because of with the pandemic, with kind of physical distancing maybe too, we're not going outside, we're not going places maybe, right? Walking around the grocery store in the same way that we used to. So we're getting less activity than we used to. So I think really making sure that you're prioritizing activity level to kind of the level that you're able to, right? And of course, being able to kind of work within your own kind of boundaries of your physical health, but being able to prioritize activity is one really big thing. The next thing is trying to prioritize sleep. So really good sleep hygiene, having set bedtimes, set wake times, being able to minimize caffeine, being able to cut out blue screens. So thinking about, and I'll talk a little bit about this in terms of the news these days too, but limiting blue screens, especially right before bedtime. So watching TV, scrolling on your phone, on a notebook, electronic kind of notebook. All of these things can interrupt kind of sleep patterns and lead to sleep dysfunction in terms of having difficulty falling asleep or waking up multiple times in the middle of the night. With the pandemic too, is I noticed that all of our routines have they've been blown up. And our routines are much different than they used to be too. And so making sure that you establish a really good kind of structure to your day and a routine through your day too becomes really important. With everything going on in the world right now, okay, there's a lot of distress, not only just because of the pandemic, but we have a lot that's going on in terms of politics, racial injustice, these things can be exceptionally distressing for folks too. And I found that it's really useful to be able to decrease news consumption right now. So to limit kind of the amount of time that we have the news going on, the amount of time that we are scrolling through our feeds. You know, these days we can have the news on cable networks for 24/7 if we really wanted to. And so we can become really easily inundated with a lot of information and a lot of really distressing information too. So I think, you know, certainly I'm a firm believer of kind of understanding what's going on in our world and being able to kind of advocate for ourselves. And I think information and education is really important in that way, but limiting it so that we can kind of minimize the amount of time that we're exposed to that. Next screen. Okay. So a couple of other things that I think about. One of the big things that I do in my own work is something called cognitive restructuring. So it's thinking about the different thoughts that impact how we feel and the different thoughts that impact what we do. And part of my job and part of what I do is helping folks and for us to take a little bit of a step back and to be able to think about different thought patterns that might be driving some of our distress or some of our worry or changes in mood, and allowing ourselves kind of to be able to take that step back and to reevaluate some of those thoughts. Taking positive kind of health habits. So really thinking about, I'm sorry, the impact of health behaviors and kind of focusing on some of those health behaviors. So if you're noticing that you are doing a little bit more in terms of drinking during this time to help with the pandemic, so being able to kind of notice that and think about kind of other ways in terms of health behaviors that might be helpful too. Pace yourself, okay? As you're undergoing treatment, as you're dealing with cancer, it's really important to be able to pace yourself. So you might not be able to put that same amount of time doing something that you used to do, right, with the same amount of kind of effort level. And so it becomes really important to be able to just pace and to take breaks in between as you're doing things, okay? To think about different ways to be able to engage social support. And this becomes really hard in the pandemic. But I think it becomes important to be able to be creative about some of this and to figure out ways to be able to remain connected with people who give you support, who lift you up, people who have your back. And trying to figure out how to be able to remain kind of connected with those people in a safe way, of course. Now, the last piece is thinking about mindfulness and relaxation practices. Next slide. I've listed a couple of relaxation techniques, and when I talk about relaxation, it's I don't like the word because I think you know, we just say, well, just relax, you know. It's more kind of a way to target kind of physiologic arousal and feeling kind of that tenseness, that feeling of being anxious. So these techniques help to be able to decrease that fight or flight response that you're experiencing that underlies or is attached to kind of worry or anxiety. So there are visual imagery exercises, body scans, diaphragmatic breathing, progressive muscle relaxation, and then starting a mindfulness practice can be exceptionally helpful too. And these days we have lots and lots and lots of applications out there and resources to be able to help folks to start up a mindfulness or a meditation practice. So there are applications like Calm, C-A-L-M, one called 10% Happier, and another one called Headspace. Those are 3 applications that I've played with myself, but they become really, really useful, and we see brain structural changes that actually happen with folks that engage in robust mindfulness practice too. So decreasing kind of your fear response in your brain. And so these can be really useful. Next slide. Okay. And then one of the other things that I think about too is as physical functioning might change with your disease, or as you're going through kind of chemotherapy, for example, too. What becomes really, really important is to be able to think about what gives you meaning, what gives you purpose, what gives you value. And if you're not physically able to engage in those things that gave you meaning, purpose, and value, the whole idea is to identify those particular values and then to be able to think about how you can do things in a different way to still have that value present, rather than just not engaging in those things at all. I don't know if that makes any sense. We can play with that a little bit more too. But what I found is that depression comes from this loss of meaning, this loss of fulfillment and role changes. And so it becomes really important to be able to figure out how to have those things still present for you, and to not lose that in your day-to-day. And then figure out how to structure that consistently in your day becomes really, really helpful to help with changes in mood. Next slide. Okay. So to be able to just wrap up, and then I want to give some folks some time to be able to talk and to be able to ask questions. Changes in mood and worry are really normal. They're really normal in with folks that have been diagnosed and are going through cancer treatment. And this is made all the worse by the pandemic right now. And what I found is that mental health concerns are really not often talked about with folks oncologists. It's not something that people discuss. And I think there are a couple of reasons for that. A couple of them, one is I think time. Sometimes those appointments can be really tight. They can be very short appointments. You're kind of checking in, you're focusing on kind of the disease, you're talking about kind of the treatment, right? But the focus tends to be a lot of times just on kind of physically how you're doing. And then too, I think because of stigma, I think people don't talk about it, right? And then other times folks are, they want their oncologist to see them doing well, and it's really important for them to have their oncologist see them as doing well, and so maybe people don't talk about this information either. But I really encourage folks to have these active conversations with their physicians, because their physicians might have really good resources to be able to get them hooked up with folks who can help. Talked a little bit about just how changes in mood and worry can impact quality of life. And like I said, I just encourage folks to be proactive and to prioritize this along with their physical health care too. Next slide. Okay. So here is my information. This is my phone number for folks to be able to jot down if they have any questions too that they don't want to ask in a forum. Feel free to contact me if you guys have any thoughts. I want to turn it over to you guys if folks have any particular questions for me.